So this slide simply demonstrates the action of the bit. So you'll notice that we've got someone pressing the cheek of the horse in. This simulates what happens when the commissure, the corner of the lip, is pressed by the cannon of the bit. And you'll notice that all along the cheek comes over the edge of the tooth. So if we've got sharp points, if we've got any kind of overgrowth, this is going to mean it's much more likely we're going to get ulceration or cutting of the horse's sensitive cheeks. So here we're seeing a young horse. I want you to take a really good look at this photograph for a second. Here we've got a young horse that's been sent off for mouthing or breaking or educating, whatever term you want to use, who hasn't had their teeth appropriately attended to before having that bit in the mouth. So it would have been as simple as simply removing these sharp points and possibly removing that wolf tooth, and yet when we look at this horse's cheeks, I mean, look at that. It's red raw, it's bruised. I think we can agree this is A, a welfare issue, B, a performance issue, and C, potentially a nutritional issue. So for this young horse, for their first experience, we've taken a backward step, and it's a backward step that was 100% preventable or avoidable. So here we see the mouth of an older horse. Again, extremely sharp points, and again, a very similar situation with the ulcer there on the cheek. This sort of scenario is the type of horse where perhaps they've had a spell for some reason, you brought them back into work, and perhaps you've decided to bring them back into work before attending to their dental conditions. Again, 100% avoidable. If that horse had simply had appropriate dental care before starting work, we wouldn't have this ulceration. Okay, again, there's a serious problem here. We've got a sedated horse in the crush with head support, with a speculum, with a light, with a clean mouth, and I'm clearly identifying there's a problem and that it's in the middle of the photograph. So with all of that help, you should be able to identify it. If you're still having a little bit of trouble, I'm going to just show you the next slide. So now with the mirror in place, you can see there's a small red dot in front of that first cheek tooth. You can see it better in the mirror. What is it? Well, it's a wolf tooth sitting directly at gum line. You can see it's quite subtle, but in this particular horse, this is very painful. So the point that I'm making there, I suppose, is that some of these things are quite subtle, but although they're subtle for us, when we look at them, they can cause enormous pain or discomfort for the horse. And it's as simple as removing that tooth. Here we're seeing another common condition that you're going to pick up on a decent oral examination. So we're looking at the first lower cheek tooth of a horse. You'll notice that it's very smooth. If you could touch that, it would feel like porcelain. And what's happening here is that this particular horse obviously grabs or chews the bit, and the action of that metal and saliva polishes the surface of the tooth. This can start for a number of different reasons, but broadly speaking, it's going to be either pain or a behavioural avoidance. But very quickly it becomes a habit, and once it's a habit, you're unlikely to stop the horse from doing it. Again, we're looking at that commissure, that corner of the lip, and what we see here is a very large bruise. Again, this could be a one-off accident, but by simply checking this area before and after each ride, we can identify this problem, and it may alter the management of this horse for some time. It's a fairly subtle but very painful problem in this photograph. It's right in the middle of the photograph. Again, sedated horse, crush, speculum or gag, clean mouth, light source. We've moved the tongue. We've put the problem right in the middle of the photograph, so hopefully you can identify it. If you're having trouble, literally draw a line from one corner of the photo to the other and back again through the opposite arcade so that you make an X marks the spot. And right in the middle of the photo, if you make a line coming from the first cheek tooth down to the canine tooth, you should see that on the horse's left there is a lump halfway between those 2 points. So what's that lump? It's a sequestrum. What's a sequestrum? It's a piece of dead bone in the jaw. So this is a bitting injury. So the bit here has come down hard on that bone and destroyed the blood supply to that piece of bone. This is enormously painful for the horse. It needs surgery to correct it. If we don't remove that piece of bone, this horse certainly can't be ridden in a bit. In this particular horse, if you try to ride him with a bit in his mouth now, he's a completely different horse. He simply bolts and, funnily enough, turns one way. Here we're seeing the same horse. On the left we see the horse before treatment. On the right we see the horse after treatment. I should point out this horse will require further treatment, but I just want to explain why we do this in what we call staged reduction. So we do it in stages. If you look carefully at the surface, the chewing surface of those teeth, you'll see some dark brown areas. Those dark brown areas are filled with dentine, okay, and underlying the dentine is an area called the pulp. What's the pulp? Well, basically it's the nerve of the tooth, okay? So with this overgrowth, if we go in there and we start reducing it or aggressively reducing it and removing it, we don't know how far that nerve is into the tooth. And if we expose the nerve or damage the nerve, we have a 100% guarantee that we will kill that tooth. So very quickly I want you to do something with me. I want you just to, without clamping down hard on your jaw, just look up at the ceiling and then gradually bring your head down to tuck your chin onto your chest. Just do that again for me a couple of times, and you should notice as you lower your head something happens to your bottom jaw. As you lift your head, your bottom jaw will move again. So as you lift your head, your bottom jaw glides back, and as you lower it, your bottom jaw will glide forward. Okay, this is called rostrocaudal movement. Rostral just means to the front, caudal means to the back. It's normal in all mammals, it's normal in horses too. So if we look at this photograph again, with this large overgrowth on the front of this first cheek tooth, when this horse lowers its head, is its bottom jaw likely to be able to glide forward freely? No, that's right. So this is an impediment to this horse's normal jaw movement. That means it's a problem in order for the horse to be able to chew normally. It's also a problem for collection, particularly for dressage. And the other potential issue here is a welfare issue, because that long overgrowth can certainly reach a point where it's going to touch the delicate soft tissue on the lower jaw. Here's another common problem. These are what we call transverse ridges. It's normal for horses to have ridges on their teeth. They increase the surface area for chewing and grinding. Okay, what we're looking at here is these ridges running from the palate across towards the cheek, so that's the transverse direction. Running from the front of the tooth to the back is the sagittal direction on the chewing surface. However, just like sharp points, if those ridges are not being maintained at a normal level, in other words, as the horse chews, they're not wearing them away, they're just getting bigger over time, then they become whatever term someone wants to throw at you. So exaggerated, accentuated, enlarged. But basically they're too big. Now we're just going to look at another slide that demonstrates. Okay, so here you see the side-on view. If anyone's watching this presentation and is wearing a jumper or a top that has a zipper up the front, I want you to try something for me. I want you to see if you can just move one half of your zipper without moving the other half. No, of course not. It's a ridiculous idea. So, if we think about it this way, with transverse ridges like this, is this horse's bottom jaw going to be able to glide independently and freely in relation to its top jaw? No, it's not. So this is one of the big issues with these excessive transverse ridges. It impedes that normal rostrocaudal movement. The other thing that we have to look at here is that usually when these transverse ridges occur, they're going to tend to occur where two teeth line up. So the transverse ridges on the upper jaw have the potential to push down where the two lower teeth meet and gradually drive them apart, creating a space. We call that space a diastema. Diastema simply means space, but it's a space that now food can pack into. So we get a space that shouldn't be there between teeth. We get food packing into the space, which means we now have a periodontal problem. Now, periodontal disease is something you're going to hear a lot more about in horses. It's the most common dental disease of horses. Okay, so again, here we are looking at a sedated horse, clean mouth, speculum, problems in the middle of the photograph, so you can all see it, can't you? Okay, just a bit of history on this horse. He had his wolf teeth removed 8 weeks ago, and since removal of the wolf teeth, he now rears with any kind of bit contact. If we look carefully just in front of the first upper cheek tooth, you'll see some discoloration. And here, after x-raying the area and examine it, we have removed the remaining tooth roots that have been left behind during the previous extraction. This is why the horse is now rearing, because those tooth roots are sitting just at gum line with the nerve exposed, and on the occasions when the bit make contact with that area, it's extremely painful for the horse. This slide shows the lower jaw of a horse, and it's just to show you that horses can get lower wolf teeth. Again, not as common as upper wolf teeth. This one's quite small, and you can see how without a detailed examination it would be fairly easy to miss. Again, there's a nerve in that tooth. It's going to be an easy area for the bit to make contact with. Quite likely that it's going to be painful for the horse. Here's that tooth and the tooth from the other side of the jaw having been removed from the horse. You'll notice again the coloured area at the bottom of the tooth is the crown, or the part in the mouth. The red area represents the root of the tooth, and the red itself is the periodontal ligament. Here we're looking into a horse's mouth. We're looking about halfway along the arcade, and we see a fairly substantial ulcer to the cheek. This horse has had its teeth done recently. It doesn't have any sharp points. However, it does have this ulcer. In the history with this horse is that it went to a competition recently. The instructor tightened up the noseband on this horse. Horse went out, refused to jump, and for a couple of days since has been drooling, salivating, and not wanting to eat food. This photograph simply demonstrates the problem in this horse. So here we're using the halter to substitute for this horse's bridle, and the finger points out the area where the noseband and the buckle are, and this is exactly where that ulcer was that we saw on the other side of the cheek in the horse's mouth. So in this particular horse, this sensitive horse, this injury has had a massive effect on this horse. Okay, so I want you to look at this, and I want you to think about a couple of things. Firstly, would you know your horse had this problem? And the answer to that from clinical experience is probably not. Secondly, is this a welfare issue? Thirdly, is it a potential performance issue? Fourthly, what are the odds that we're going to save this tooth? And the answer to that is that we're not. So this is periodontal disease of a cheek tooth. Okay, we've got a displaced cheek tooth. So you can imagine that if you put a halter on this horse, if you put a bridle on this horse, that the bulk of the pressure on that cheek is going to rest on this one mobile, painful tooth. Is this preventable? Yes, because earlier detection and treatment would mean that we wouldn't now be losing this tooth. Is this painful for the horse? Yes, absolutely. Okay, here we're looking inside a horse's mouth. We're looking at their tongue, and the obvious question is, would you ride this horse? Well, of course not, but then you have to ask yourself the harder question of, would you know this horse had this problem? Here we see another horse. This time we're looking at the underside of the tongue. So again, it's a really important area to examine before and after you ride your horse. You can see the degree of ulceration and trauma there, and if you look carefully at the area just above the bite plate of the speculum, so the metal area, you'll see some greeny brown seeds. These are barley grass seeds, and these are what are responsible for the trauma in this particular horse's mouth. So here we see a horse, and again, regardless of your personal preference for breed or conformation, I think we can agree this is a healthy horse, well cared for. Now we're looking into the same horse's mouth. We're a long way back in the mouth. You'll notice how bright the picture is. So again, sedated horse, in a crush, using a speculum, with a light, clean mouth. We're right up the back. We've got a mirror in there. So the problem should be obvious to you. If it's not, we'll talk you through it. Running your finger down the teeth on the photograph against the palate, so that's the area of the ridges, we come to one tooth that sticks out into the mouth more than all the others. If we look at it up the middle, you can see what's happened. The tooth's been split in half. This is called a sagittal fracture, so remembering back to transverse ridges, transverse is running across the chewing surface from the palate to the cheek, sagittal is running across the chewing surface of the tooth in a front to back direction. So this tooth split completely in half. We've removed all the food from the middle of the tooth. So is this painful for the horse? Yes. Is the tooth salvageable? No. Is this a welfare issue? Yes. Is it a potential performance issue? Yes. Would you know the horse had this problem? Think back to the previous slide. Okay, from the outside, he looks fine. He doesn't exhibit any obvious symptoms. The importance of a detailed dental examination. This is just an x-ray of the same horse taken from above, clearly showing that the tooth is split in two right through. So, in summing up, I'm not going to go through all those points, but I will make a couple. Firstly, no horse should last more than 12 months without a detailed dental examination. It's not to say that a horse that goes more than 12 months without a detailed dental exam is going to drop dead. However, just like ourselves, if we miss these things, if we don't stay up to date, there will be problems developing. We will see oral pain, some problems more serious than others. The key is early identification, early treatment. Down the bottom on the right hand side, you'll see some information about a website. That website will provide you with some more information.